Now, most people don't realize this, but your recovery after tummy tuck is just as important as the surgery itself. How you take care of yourself in the first few weeks determines how flat your abdomen is, how smooth your scar heals, and how long your results will last. In fact, I'd say the recovery phase is where a lot of your final result is actually made. And that's something a lot of people don't know before going into surgery. Hi, I'm Dr. Shim Ching, board-certified plastic surgeon here in Honolulu, Hawaii. Today, we're talking about part 2 of what you need to know before tummy tuck. In part 1, we covered who's a good candidate, how the surgery works, and what kind of results you can expect. In this video, I want to take you behind the scenes of recovery and what it actually feels like, what's normal, what's not, how to set yourself up for the best possible outcome, because this is what I want for you. These are the questions I get every single week in consultations. And if you're thinking about a tummy tuck or you're already scheduled, this will give you a realistic picture of what to expect, what recovery actually looks like. So let's start with number 1 question. How long is recovery? For most patients, I tell them to expect 2 to 3 weeks of real downtime. And that doesn't mean you're in bed for 3 weeks straight. It means you want to take that time to truly rest, stay at home, and focus on your healing. You'll be able to walk around, get up to eat, move gently, but you don't want to drive, go to work, or do anything really strenuous during that time. A lot of my tummy tuck patients are moms who've had children, and the first thing they ask is, how does this compare to C-section? And that's actually a really good comparison. The discomfort after your tummy tuck will feel very similar. That tightness, the soreness when you stand up, the feeling like your midsection just doesn't want to move too much is not identical, but almost all moms tell me that it's about the same level of intensity. For those first 2 to 3 weeks, your job is simply to rest. Don't plan to do errands, travel, go to work. This is not the time to push yourself. It's time to let your body recover properly. After those first few weeks, we'll guide you through a gradual return to normal activity. We'll start with short, gentle walks, then light movement, and eventually over the next several weeks, we'll reintroduce light exercise. In my practice, we have a very detailed recovery plan that tells you exactly what you can and can't do at each stage. And this is something that's really important to go over carefully with your surgeon because everybody heals a little differently. Every surgeon does things a little differently. One of the biggest things you need to understand after tummy tuck is that your abdominal muscles have been repaired. During surgery, we tighten those muscles, the same ones that often separate during pregnancy, a condition called diastasis recti. When those muscles are repaired, it gives you a flatter, tighter abdomen, but those stitches need time to heal. If you start engaging your core too soon, you can strain that repair. And that's one of the most common mistakes people make when they feel good early on. They start picking things up, twisting, or even doing light exercises that still engage their core without realizing it. And that's why I always emphasize, avoid doing anything that causes you to tighten your abdominal muscles for at least several weeks. That includes bending forward quickly, lifting heavy objects, or standing up without supporting yourself with your arms. We'll teach you how to move safely after surgery, how to roll out of bed, how to stand up, how to get into a car, small things that make a big difference in keeping your incision protected. Now, let's talk about pain management, because that's something that people worry about before surgery. The good news is that pain after tummy tuck is very manageable, especially with modern anesthesia and a medication option. In surgery, I inject a long-acting local anesthetic throughout the entire abdominal area. I mix it with a small amount of steroid, which makes it last longer, usually between 12 to 20 hours. This blocks certain nerves in the area and provides pain relief right after surgery. That local anesthetic slowly wears off throughout the night, and by the next day or 2, you will start to feel the tightness build. The first 2 or 3 days are usually when the discomfort peaks, and then it steadily improves from there. We'll prescribe pain medication to help during those first few days. Some patients do well with mild narcotics. Others prefer anti-inflammatories or muscle relaxers. We'll tailor that to what works best for you and your comfort level. Everybody's pain tolerance is different, but almost all patients tell me that they got through it easier than they expected. By the end of the first week, most people are already up, moving around comfortably, and sleeping better. Now, one of the most important parts of recovery is rest, and not just physically resting, but mentally allowing yourself to slow down. Your body has just been through a major operation. Trying to do too much too soon can cause swelling, fluid buildup, or even compromise your results. I always tell patients, don't treat recovery as an inconvenience. It's part of your treatment. Those 2 to 3 weeks are when your body is rebuilding itself. And this is when the incision is healing, muscles are knitting together, and your swelling is starting to go down. Have support at home. Somebody to help with the kids, meals, or errands if needed. If you had a C-section before, you'll recognize how those first few days feel. You'll walk slightly bent forward at first, move slowly, and gradually stand straighter each day. Most patients find that within a week, they're already walking more comfortably and feeling much better. After surgery, we'll have you wear a compression garment. It's not the most comfortable piece of clothing, but it's incredibly important. The garment helps control swelling, supports your abdomen, helps the skin adhere to the newly tightened muscles underneath. You'll wear it most of the time for the first few weeks and then gradually less as your swelling goes down. It also makes patients feel more supported when they move around, especially when standing, coughing, laughing, which can otherwise feel tight or sore. Patients will have small drains placed to help remove fluid from the surgical area. We'll show you exactly how to empty and record them. Most drains come out within the first week or two, once the output decreases. During that time, some swelling and bruising is normal. It's all part of healing. Swelling can last for several weeks, sometimes even a few months, as your body settles into its new shape. The incision is very low, just above the pubic area and runs from hip to hip. Designed to be hidden by most underwear or swimsuits. Initially it's pink or red, but it will fade over time. We recommend silicone-based scar treatments and keeping the area protected from sun exposure to help the scar mature nicely. Over the months, it will flatten, lighten, and most patients are very happy with how discreet it becomes. Now let's talk about when you'll start to see your results. You'll notice a difference right away. Even in the recovery room, your abdomen will look flatter. But it takes time for that swelling to go down and the final shape to appear. At around 3 months, you'll start to see your true results emerge. The contour becomes smoother, swelling is decreased, and your core feels stronger. By 6 months, most people feel completely back to normal, and at 1 year, you're seeing your final outcome. Every week, your body continues to refine. Swelling lessens, tightness eases, scars fade, and you'll feel more confident in your movements and your posture. I also tell patients to be patient emotionally. It's common to have ups and downs during recovery. One day you feel great, other day you might feel frustrated or tired. And that's totally normal. Your body is healing and your hormones and your energy levels are adjusting. Most patients tell me that around 4 to 6 weeks, they finally start feeling like themselves again. When I see patients after a 3-month follow-up, there's always a moment when they stand taller, their clothes fit better, and they realize how much their shape has changed. That's when it really clicks for them. The hard part is behind them and the transformation feels complete. If you follow your recovery plan carefully, rest, wear your garment, avoid strain, give yourself time, your results will continue to improve every single week. A tummy tuck doesn't just change the way you look, it changes how you carry yourself, how you move, and how you feel. Many of my patients tell me they feel stronger, more confident, even notice less back pain because their core muscles are finally supporting them again. So if you're preparing for this surgery, remember, the recovery is part of the journey, not an obstacle. It's where your body adapts to all the positive changes that the surgery created. If you found this helpful, I encourage you to watch part 1 if you haven't already. In that video, I explained who's a good candidate for a tummy tuck and what the procedure actually involves. I'm Dr. Shim Ching, board certified plastic surgeon in Honolulu, Hawaii. Thank you so much for watching, and I will see you in the next video.